Hello, and welcome back to the Gluten Free RN podcast. I'm Nadine the Gluten Free RN. Today, during episode 64, I'm going to give you a recap of a recent conference at Columbia University Celiac Disease Center in New York City. Stay tuned. Lots of information today. Hi, I'm Nadine the Gluten Free RN, and this is episode 64 of the Gluten Free RN podcast. I recently attended the Columbia University Celiac Disease Center conference on celiac disease in New York City. The title of the conference is Celiac Disease Now and the Future, an International Symposium, hosted by the Celiac Disease Center at Columbia University, and it was held March 2nd and 3rd of this year, 2018. This has probably been about the 6th or 7th time I've attended this conference. I'm always very excited to go. One, because I get to go to New York City, and two, because I get to meet some very fascinating people, and I get to hear more talks about celiac disease from the scientific community. I did, in fact, just go to the International Celiac Disease Symposium in India, and a lot of the same people attend both conferences. There were lots of good information and also some information that I found somewhat suspect, so we'll talk about that today. I would also like to thank everyone that has left a rating or a review of the Gluten Free RN podcast. It really does help me decide where to take the next podcast in the future, and it gives me a really good idea of whether you are getting the information that you need. So thanks to the Metal Maiden for a lovely review of the Gluten Free RN podcast for iTunes. I really do appreciate it. So huge shout out to you, Metal Maiden. And also thank you for following me on Instagram, Facebook, Twitter, anywhere that you get social media information. At this point, I would like to remind you that all of these opinions and reviews and information, it's my own. Any information that I speak about is not influenced by anyone else, including corporations and pharmaceutical companies. That cannot be said by everybody that does a podcast or where you get information about celiac disease from. Please be very careful. That doesn't mean that I don't have my own biases, but as a nurse and as someone that is very concerned about public health, I make darn sure that the information that I give to you is untainted, which means I don't take money from pharmaceutical companies or drug companies, corporations that manufacture gluten-free food or products. The information I give you is my own interpretation of the research articles, interviewing thousands of people with celiac disease and doing consultations with them, and also speaking with industry leaders. Some of those conversations get very spirited. Some of those conversations get very interesting. And some of those conversations actually get cut short, depending on the questions sometimes that I'm asking. If people don't like the way a conversation is going or the questions that are getting asked, frequently they will need to excuse themselves from the conversation. That's okay. It doesn't mean the questions don't need to get asked. Speaking of questions, I'd like to shout out Tiffany, my new best friend, who's also a nurse. She works in Emerge in Canada, and she actually met me at this conference. We had talked previously, but this was the first time we had met. She's a young nurse and really sharp and understands how health, nutrition, and what the effects of food have on our bodies. She did a great job of asking questions that needed to be asked of the people that were on panels or that had just spoken at this conference. And I could tell by the questions that she was asking and the answers that she got that perhaps a lot of work needs to be done yet. And we all know that, right? We all know that there's a lot of work to be done on celiac disease. First and foremost, the idea would be to find people with celiac disease, which again is why I am a huge advocate for a mass screening of celiac disease for everyone. regardless of where you live, regardless of your age. I really don't care if you're 95 years old. everyone should be tested for celiac disease because it's a quality of life issue, and it's a cost-effective way of preventing people from getting sick. And just a reminder for those of you that don't live in the United States is one of the only developed countries in the world that do not have universal health care or some form of social medicine. We are a for-profit healthcare society, and interestingly enough, at this time in history, healthcare is our number one industry. Think about that for a little bit. That doesn't mean other countries aren't necessarily doing the best job of finding people with celiac disease, but they're certainly at least attempting to find people with celiac disease. Again, it depends on education level of the healthcare provider, whether the patient is an advocate for themselves or their family members. There's lots of factors here, and really we should just be cutting to the chase and trying to find everyone that potentially has celiac disease or non-celiac gluten sensitivity, because the treatment is the same. The treatment is avoiding 100% all gluten for the rest of your life. It is a lifelong 100% gluten-free diet at the very least. And for many of us, that's not enough. And for many of us, it involves going on some form of a whole food diet, which is meat, fish, and eggs, nuts and seeds, and lots of vegetables and some fruit. If you can stick with that type of diet, there's a good chance your intestines will heal and you will have less of an opportunity to get cross-contaminated or contaminated with gluten, which of course is one of the ways that people remain sick or don't heal when they actually get a diagnosis of celiac disease, go on what they think is a gluten-free diet, but find out it's not enough, either because they're still getting gluten or they're getting the cumulative effect of eating products that are labeled gluten-free, but are still maybe less than 20 parts per million. But when you start multiplying that by multiple products that are labeled gluten-free, but still contain, let's say, less than 20 parts per million, but that would be 19 parts per million times 4 or 5. And then we begin to see why that could be a problem. Focusing on a whole food diet really is one of the best ways to heal from the damage caused by gluten or the grains. So as I've said before, this is a really good conference for me to go see what's going on, meet new people, keep an eye on the doctors and the pharmaceutical companies, and find out what actually is occurring. Because some people actually talk at these meetings, and they say some very interesting things. I included the brochure from the conference itself, so you can look and see who actually spoke and when they spoke, and some of it was different on that handout than the one that we were given at the actual conference. But overall, the topics were similar, and thankfully, Tiffany was there, and she was able to attend the clinical program while I focused on the international symposium, which was up on the 3rd floor. This was the first year that the conference had the interesting caveat that the clinical program was specifically for nurses, RDs, and lay people, while the International Symposium upstairs was focusing on physicians, scientists, industry, which is including the pharmaceutical, diagnostic, biotechnology, and food and agriculture, and investor venture capitalists. Isn't that interesting? I thought that was interesting too. One of the things that Tiffany really enjoyed listening to was how celiac disease was managed in Italy, which was presented by Carolina Ciacci, MD, from Italy. And she said that she was amazed at how much different celiac disease was looked at, treated, covered, how people were really taken care of, and that it is illegal not to serve gluten-free food if you serve food. So let's just say it's a school or a hospital or a restaurant, even a bed and breakfast. If you serve food, you have to serve safe gluten-free food. It's the law. Traveling around Italy, people have found that it's extremely easy, even with a diagnosis of celiac disease or non-celiac gluten sensitivity. One of the things that I found most amusing and somewhat frightening was that General Mills was allowed to give a presentation. And for those of you that do follow me on Facebook or Instagram, or Twitter, you saw that I posted some slides from that presentation because it did, in fact, make my eyes bleed to a certain degree. And I had a hard time not laughing out loud and questioning why, in fact, General Mills was there. But come to find out, General Mills was a major sponsor for this conference, which then dictates who gets to speak, and they did get some time on the floor. Again, always interesting, always entertaining. Not quite helpful, especially since the representatives from General Mills interestingly stated that they hand-picked and hand-separated all of the grains that came into General Mills. They separated the oats from the wheat and the barley because they don't source certified gluten-free oats from the farmers themselves. So think about that for a second. They're making cereal, gluten-free cereal, and in this case, Cheerios, from grains that are contaminated. Now, I did show the slide on Instagram and Facebook and whatnot about how similar those grains look. So good luck separating them in any way, shape, or form from each other, not to mention all the dust and the fragments. It just doesn't make any sense, and it was quite absurd. So my advice to you is if you are still eating gluten-free Cheerios, please be aware that they are not gluten-free. There is no way that they can be gluten-free, and they've already had one recall. Canada doesn't allow them to be sold in Canada because they're not truly gluten-free. The risk of contamination from Cheerios is enormous. So my advice to you from the Gluten Free RN would be, please don't eat them. They're empty calories. There's nothing nutritionally important in them at all that you need. They are empty calories. Find something good to have for breakfast like bacon and eggs, sauteed Brussels sprouts, sauteed kale, anything other than Cheerios. Another interesting point that was made, and something that I follow very closely, is this idea of the gluten challenge, of taking somebody that's already been gluten-free, or one of the doctors don't believe that a person actually had the correct test or the correct diagnosis. So they actually put people back on a gluten-containing diet that have been either potentially diagnosed with celiac disease or chosen to go on a gluten-free diet for health reasons or for any reason. At this point in history, I don't care. There's no benefit for me for saying I don't think anybody should go on a gluten-free diet unless they have a diagnosis of celiac disease. There are many reasons people cannot get a test for celiac disease. There are many reasons that it is cost prohibitive for people to pursue testing for celiac disease, especially in the United States where we have for-profit healthcare. So many people will not get diagnosed strictly because they don't have access to healthcare. Even if they have insurance, they may not have access to physicians or doctors or healthcare providers that know anything about celiac disease, how to test for it, or when a test comes back positive. So on that topic, Dr. Bonaj Aubrey from the University of Chicago Celiac Disease Center had just said that once they are on a gluten-free diet, then to actively re-challenge them with gluten becomes problematic, and she wouldn't do it. And I thought, well, bully for her. They shouldn't be doing it. But then I went up and I talked to her, which didn't actually clarify the issue. But she said, no, she meant only potential celiac disease patients. She wouldn't put potential celiac disease patients on a gluten challenge because that would be problematic and she wouldn't do it. And I said, well, what do you mean by potential celiac patients? And she said, only patients that have had positive serology, but a negative biopsy. And I thought, well, that's really interesting because, and I do believe, and I don't have this actually written down, and it was at one of the other conferences, but I think it was Dr. Guandolini from the University of Chicago that said, if a patient has a positive antibody test, which means they have a positive EMA and a positive TTG, then they have villus atrophy, whether they can find it or not. So the biopsy we know is not considered to be the gold standard anymore. Here we have a situation where people actually have positive antibody test. The doctors can't find the villus atrophy, but these people are not yet diagnosed with celiac disease. Why is that? Well, perhaps because the only people that can volunteer for the studies would be the people that are biopsy proven. I write about this in my book, Donation. It is very concerning to me that anybody with damage to their intestines, which, let me remind you, is organ damage, would be put back on a gluten-containing diet to cause more damage. I just cannot wrap my head around the fact that these doctors know that these patients have massive expansion of T cells with a gluten challenge, which means their bodies are reacting, their immune system is reacting directly to the gluten that they eat, whether they have symptoms or not, whether the doctors can find that villus atrophy or not. Keeping in mind that the biopsies themselves are only taken from a couple inches into the duodenum. And if you think about it, the GI tract is about 30 feet long. And if the biopsies are only being taken from, and I'll give them maybe a foot into the duodenum, then there's 29 other feet of the GI tract that is not being tested. So the fact that a person with a positive blood test, but a negative biopsy, perhaps those people are all celiac, based on the information from the University of Chicago itself. And we all know that people with undiagnosed celiac disease are at risk for increased morbidity and mortality. Morbidity is sickness, mortality is death. So ideally, we are going to find these people very soon and completely put them on a gluten-free diet without challenging that. It does not benefit the patient, especially in the United States, to have a gluten challenge because there is no healthcare benefit to protect them or as an asset. I am not biopsy proven celiac. Trust me, I have celiac, but there's no benefit for me to have a official diagnosis of celiac disease despite the fact that I have dermatitis herpetiformis. As I've mentioned before, if you have DH or dermatitis herpetiformis, you have celiac disease. It's 100%. So what we're putting people through is unnecessary, unethical, and should not be allowed. If anybody wants to debate me about that, I happily will debate them. I've been doing this for 11 years now, and no one has taken me up on the offer to debate that issue. And ideally, I'd like to debate that issue in a public forum or on a panel. There were a few other talks on interesting topics such as detecting gluten exposures in stool and urine. So there's a couple point of care testing that may come out in the near future. Point of care testing, POCT, which means that you can test at home or you can be tested in the doctor's office. It's a pretty quick and easy test, which means that gluten shows up in your stool. Go figure, no big question there. But it also shows up in your urine. So in order for gluten to show up in your urine, it has to be systemic. That gluten has to be going through every body system. So an interesting point was made and a question was asked at the very end of the conference. And the question was, well, at this point, we should be able to put to rest the fact that it doesn't matter what you put on your skin, and gluten obviously is not systemic, and therefore we can put that to rest. Well, one of the doctors who says some really interesting things sometimes, this time did say, well, I'm not quite sure that we can actually put that to rest, given the fact that we're talking about testing for gluten in the urine. Obviously, it's systemic, and perhaps we need to reevaluate those statements that we've been making for all these years as far as whether topical gluten actually affects people. Perhaps we don't know as much about that as we thought in the past. So gluten is systemic and potentially can damage every organ in the body, including the kidneys and the bladder and the ureters, because it is systemic and it does cause inflammation. It causes inflammation. It's pro-inflammatory to the epithelial cells, which are not just in the small intestine, they're everywhere. One of the other things that occurred globally at this conference was there was very little disclosure of pharmaceutical money being taken or who was sponsoring different talks or who was actually personally or professionally invested in any of the pharmaceuticals that potentially will come out to treat celiac disease. There's a lot of talk about curing celiac disease or treating celiac disease. My stance has always been and will continue to be until I see something dramatically different or much more compelling, that there will never be a pill or a treatment to treat celiac disease or cure celiac disease. That idea is ludicrous and potentially dangerous and harmful to the people that are engaging in the studies themselves. So my plea to you would be to really think hard before you donate your body to science while you're still alive by being involved in a study for any of the testing for a gluten buster or an enzyme or a DNA changer or any type of medication or vaccine or immunization as a treatment or a cure for celiac disease. My hope for you would be that you would be empowered enough to choose to eat a really good diet because food is medicine, work with really good practitioners and people that know about the nutrition and how to follow up once you've been diagnosed with celiac disease, and be empowered to make those decisions as an educated person. As Americans, we are conditioned to look for a pill or a treatment plan or some type of non-dietary treatment that will make our symptoms abate or protect us from gluten. Gluten is everywhere, don't get me wrong. But the focus from my standpoint really should be on finding people, diagnosing people, helping them get better on a gluten-free diet, and not trying to make that a more difficult endeavor. And one other interesting thing, and with all due respect, anybody in a position of power, such as somebody that should be advising people about healing from celiac disease, such as an RD, nutritionist, nurse, physician, anybody that extols the virtues of other grains or gluten-free grains and continues the myth that grains are necessary and are nutritious is only touting the company line. It would be nice if we could get really good untainted information from the people that we are looking to help us get better and heal from the damage done from celiac disease. Very frequently, the only way we can help people get better is to put them on a whole food diet that does not contain any grains, and that includes oats. So we really do need to be very careful about the information that we give people and how we advise them about getting better from the damage caused by gluten-containing grains. But overall, it would be great if all of the information that we got from all of the healthcare providers that we have access to, especially at these conferences, if all of that information was untainted by pharmaceutical money or agenda. So please keep that in mind as you're hearing or reading or conversing about any of this information. Please make sure you understand where that information is coming from, just like from any other source. You want to know the source of the information. You want to know which research articles are untainted by pharmaceutical money or any other influences, and just be very aware that there's a lot of that going on, especially regarding celiac disease. The FDA was there and well represented. A lot of the same conversation was had about whether a medication was necessary for celiac disease or not. Australia is also very good regarding celiac disease. So if you want to travel to Australia, they require a less than 3 part per million standard for celiac patients. Just something to keep in mind. It can be done. And that is for the benefit of the people with celiac disease. That is not for the benefit of the food industry. That is to protect people from gluten. And that's what we all should be working towards, protecting people from gluten that need to be protected. So that's a wee bit of a recap from the conference at Columbia University Celiac Disease Center in New York City. I'm going to wrap it up there. There's a lot more to talk about, but those are some of the key points I wanted to bring to your attention, because it is important for everyone to really know what's going on so that they can make educated decisions for their own health and the health of their family, especially if children are involved. I met some great parents at the Columbia University Celiac Disease Center. I actually handed a couple copies of my book out, Donation, A Nurse's Memoir of Celiac Disease from Missed Diagnosis to Food and Health Activism. My hope with that is to make sure that everybody knows correct information about celiac disease and non-celiac gluten sensitivity as they're trying to navigate for their children, for themselves, or even for their parents. It is really important for people to know that there is an increased morbidity and mortality for people that are undiagnosed with celiac disease, and also for people that are continuing to get exposure to gluten. despite being on a gluten-free diet or what they believe to be a gluten-free diet. So if you need help as you try to heal your own body, I do offer consultations, or I do recommend that you find a practitioner that can really help you heal, that understands how to heal your intestines, get rid of the inflammation, heal your immune system so that you can have a super high quality of life, because that's what this is all about. This is all about a quality of life issue and being able to live large and live to the fullest. Nobody wants to be sick. We all want to be healthy, and this is just one way that we can be healthier and live large. So thanks again to everyone for listening to episode 64 of the Gluten Free RN podcast. I'm Nadine Gruskowiak, the Gluten Free RN. And if you've enjoyed this episode, please feel free to leave a rating and a review on iTunes, Stitcher, Google Player, or wherever else you listen to podcasts. Spread the word. Tell other people that the Gluten Free RN podcast is available. And at this point, we have 64 episodes for you to listen to. While they might not all be of interest to you, there are several topics, and I do try to cover the topics that need to be covered, whether they're controversial or not. So stay tuned. There's more great information coming out. I was in New York City for this conference, and then the following weekend, I went to San Francisco. So next episode, I will talk about that conference. So thanks again for joining me, Nadine Gruskowiak, the Gluten Free RN, for episode 64. I hope you found this information helpful and interesting. If you have any questions, feel free to contact me through my website or on email. And if you'd like, follow me on Instagram, Facebook, Twitter. You can find me everywhere as the Gluten Free RN. Join me next week for episode 65. Bye!